It is National Women's Health Week, a time to bring attention to issues that affect women of all ages. And this includes some conditions that might be hard to talk about, like pelvic floor disorders. Let's start the conversation now. Joining me from Memorial Hermann, we have urogynecologist Dr. Salufa El-Shat-Tanufi, and also we have pelvic floor physical therapist Prina Nair. Ladies, welcome so much to the show. Do appreciate it.
Thank you.
As I said in the beginning, I know that a lot of women hear pelvic floor and they think, can't talk about it. This is something that I'm going through. Nobody else knows what I'm feeling about. Doctor, let's first talk about what exactly is the pelvic floor and why pelvic health is so important.
So the pelvic floor is basically the girdle of bones with all the muscles, the nerve endings, and also the connective tissue. It basically controls a lot of our functions, our bowels, urination, our bladder function, sexual function. So any weakness there, any damage in the muscles in the area or the nerves, there can be a problem with elimination or any of the functions of the bowel or urination or sexual function.
And Prina, continue this conversation, the pelvic floor disorders affect more than what, 1/3 of women in the U.S. So what would you say, this is obviously a very common concern for women?
Yes, that is correct. I mean, at least 25% of these women have more than one pelvic floor disorder that affects their everyday life. And so they are common, these pelvic floor disorders. However, it's not normal. And so many of these conditions can be addressed or improved, especially if it's interfering with their everyday life and daily activities. So basically, there are different options for pelvic floor, such as the physical therapy or even surgery.
And I like that there are options. You don't need to go through life with this just because. And also, what causes this? I mean, I'm going to go with childbirth as probably the most common one.
That is correct, yes. There are many conditions, of course, childbirth being one. There's obesity as well as aging and genetics. And so whatever the case may be, here at Memorial Hermann, our pelvic floor physical therapists can address pain, weakness, and other dysfunctions of the pelvic floor to help restore your pelvic health.
And I think a lot of women will hear this and think, gosh, I didn't realize that there's something else besides surgery. Obviously, this is a case-by-case basis, but having to just do physical therapy to make that situation better could probably be life-changing for a lot of women.
Yes, that is correct, yes. Especially those who have a lot of bowel, bladder weakness, pain issues. The physical therapy is a good option, and as a matter of fact, for many cases, it's probably the first step for treatment for these pelvic floor conditions. And with us also, no physician referral is required for their initial evaluation. So we do encourage anyone suffering with pelvic floor conditions to definitely schedule a physical therapy evaluation.
Absolutely. And no, you don't have to live with it. Dr. E, let me have you weigh in here because urogynecological are there to medically manage these pelvic floor issues. So that the bottom line is have this conversation. If you think that there's something wrong, have this conversation with your doctor.
Absolutely. There is no reason to live with a condition like that. This can be severely affecting quality of life. It's important to get evaluated by a urogynecologist. They can tell you exactly what they see as far as your symptoms, the history, what they see on the physical exam, and formulate a plan for you, very much so also including pelvic floor physical therapy.
Thank you so much, ladies. And this is a true testament. You don't have to live with this for the rest of your life. You can get some really great information. Dr. El-Shat-Tanufi and also Prina Nair, thank you, ladies, so much for the input today.
Thank you.
And to learn more, you can go online to memorialhermann.org/women's health, or you can give them a call at 713-222-2273. All right.